Hi, my name's Kelsey and I'm going to be your nurse today. Can I have your name and date of birth? And can you tell me if you have any allergies? I'm also going to check in the system to make sure that they correspond correctly. While I'm looking in the system, and I'm also going to make sure that all your meds are crushable. If not, I'm going to ask the physician to change how it may be ingested, like oral, PO, and if it's a PO med that can't be crushed, I'm going to have them switch to a different type of med that is able to be crushed. And then I am going to crush all your meds, which I have here. I have just one med for you right now. In between each med, I'm going to be flushing about 15 milliliters of normal saline or tap water, either one. And we're going to do that in between each med, but right now you only have one. So we are going to get started. I'm going to make sure you're in the high Fowler's position, sitting up nice and straight. I'm also going to cover you with a towel here. All right, I'm going to wash my hands, get some gloves on. I'm going to pull the curtain, and like I said, we're going to be pushing a med through your NG tube. So now, once we get started, I am going to detach you from any suction or tube feedings that you have going, and then we're going to check for gastric residuals. So we're going to make sure there's still contents in your stomach. So I'm going to unclamp your tube. I'm going to open here. Attach my syringe. I'm going to draw it back. Make sure there's residual. I'm going to detach because I see some coming out. And we're going to put it in a nice clean container. And it looks like there's over 100 milliliters of residual, so we are not going to put any more back into you, but if there was less than 100, we would put all that residual back in so your stomach's not completely empty. And we're going to also verify some placement of the tube. And then we're going to look and make sure it's measured correctly, like it's documented in the system. And we're also, just to double check, we're going to push 30 milliliters of air, which I should have done this first. Push 30 milliliters of air, make sure we hear a good whoosh, and I hear it. I would have used my stethoscope for that. And then we're going to reclamp. And now it's going to be time to get your meds going. So we are going to start by putting 15 milliliters of warm water in with your meds to dissolve them. All right. It's just in the medicine cup here. We're going to take a tongue depressor, mix them all up until they're dissolved. While we're doing this, we are going to start to get ready to flush your NG tube with 30 milliliters. So we're going to draw that up. Make sure there's no air. We have a little extra here, so we're going to push that back. And there's no air. So we're going to unclamp, recap, uncap, attach the syringe. We're going to push. You might feel a little pressure in your stomach. That went in smoothly. We're going to recap. Now we're going to do your first medication. It's the only medication you have right now. Suck up all the medication here. Alright, since it's in the tube, we're going to get all the air out. Alright, we're going to uncap. Push the med in here. Recap. And then we're going to get some more 30 milliliters of saline or tap water, whatever we use. Get the air out of that. I'm going to uncap. Push this through just to make sure all the medication came out of the syringe. Alright, and we're going to recap. And then I like to flush an extra 15 milliliters just to be safe, to make sure no meds got stuck anywhere in the tube. just to be safe. Recap. Alright. Now once we did all this, we're going to wait another 30 minutes to reattach it to any suction or tube feedings. We're going to document that we pushed whatever med we pushed. We're going to make sure we crushed it. And we are going to provide for safety by keeping your bed the whole way down. I'm going to take my gloves off. I'm going to rewash my hands. And I'm going to make sure you don't need anything before I leave.